Good morning, everybody, and very warm welcome to the physical literacy and health literacy session, where we are going to explore how we can think about merging these concepts, putting them in a shared common model. I'm assuming many found their way here because they are already a little bit familiar with one or both of these concepts. So if I could just get a really quick show of hands, who would consider themselves more of a physical literacy person or expert? If you could just wave a little bit, maybe make a little noise. Woo, 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 woo. Okay, yeah, nice, nice. And you know what's coming? Anybody consider them mostly a health literacy person? Wave a little bit and make a little woo, 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 woo. Nice, a little bit fewer, but that's good to know. For us, for the speakers, and for your discussions to follow. I want to really emphasize that these are explorative sessions where you will maybe be left with more questions than answers, but that's critical that we think about how we can bring these concepts closer together, because historically they have been kept separate, sometimes referred to silos. And we have one intervention for physical activity, something for mental health, something for, in schools, better grades, and we can't afford to go on that way. We need to think about how we can find goal synergies and try to purpose maximize our efforts. And by bringing these literacy concepts closer together, we can have a platform to do that. And I think that's been evident in many sessions during these days about safeguarding, for example, but it's another thing to do. Or physical activity learning in schools in this room yesterday, but it's another thing on the pedagogue's table. So how can we find these ways of maximizing our interventions and efforts to address many problems at the same time? That's my hope for these sessions, that we're going to try and develop a better model and a shared platform for that. My name is Grim, by the way. I'm 50 centimeters shorter than I was there. I cut my hair, but it's me. And yeah, I work with a foundation up in northern Sweden that is called Change the Game. And we're trying to provide quality movement experiences, support movement providers in all types of contexts and sectors to help them better validate, develop, and communicate their offers. The agenda for today is a four-part structure: opening by me, and then we're gonna bring up some experts on stage to help share their knowledge and experience related to these concepts. And then we have a big co-creation workshop where we get you guys engaged in thinking about questions relating to health and movement to create something at your tables. And yeah, then a closing part by me. I first got in contact with these concepts and starting to think about how to put them closer together through a EU-funded project, Moving for Health. And this is part of our dissemination in that project. And that's where we started to think about, well, how do we draw these concepts on the same paper? How do they relate to each other, really? And it's been a great starting point for exploring this. How these concepts relate and how we can create a draft model that we are today going to continue to further develop our thinking around. And in this project, we had 4 sectors or settings that were considered crucial and that the project was limited to focusing on. So once again, I'm a little bit curious, through a raise of hands, who here is considering themselves as part of the health sector primarily? If you could just wave a little bit. It can be multiple sectors, by the way. You're allowed to wave again. Okay, well, we got some health sector representatives here. It's good. Who would consider themselves a local community person who is working with city planning or, yeah. Nice, yeah, we got some from there as well. What else? Schools. Who is working in education? Nice. I think we can cover all bases here. What about sport? Any sports people? Lots of sports people. Anybody who didn't raise their hand from some other type of health or movement sector? Nobody? Okay, nice. The model is complete. we got everybody. That's great. In this project, we also, like one of the strengths, I think, moved beyond thinking only about treating people, preventing, and to thinking also about health promotion, enhancing people's quality of life. And I think that's a really important dimension to remember and consider when we are approaching these questions together now, that it's not only about treating and preventing, but also about promoting health. Albert Einstein said that if I had 1 hour to solve a problem, I would probably spend 55 minutes thinking about the problem and then 5 minutes solving it. And I think that that's really insightful, because I'm not sure that physical inactivity is really the problem. Maybe that's a symptom and there is something deeper underneath. And actually, if somebody noticed in the gymnasts' performance on the opening ceremony, they did a sort of a tango where they were dancing in couples. And the song said that we are desperate to connect. And that really struck with me. Maybe there is underlying root causes to the problems that we see of physical inactivity, mental well-being, social division, that is disconnection from others, from ourselves, and from our environments. So I would like to invite you guys to feel connection. On all the tables, we put nice, colorful papers. If everybody could find one of those, and hold it up in front of you. And on the count to 3, we make a paper ball. 1, 2, 3. Nice. I asked Charlie and Sarah to come up and help me demonstrate what's coming next. If I could ask, please, Charlie, sit on this chair. You're all sitting on chairs as well. Sarah, stand behind her and hold your hands out like this. Don't move. Okay. I'm going to ask you guys to do the same. The person sitting opposite from you at the table, you do this together with them. One of you stay seated, the other one stand behind and hold out your hands. You're okay. It's only for a short while. And when you're ready at the starting position, try to send your balls around in a vertical square between your hands. So don't do it. Send the ball to your friend's hand, pass them around like a vertical square or circle. Try to see if you can send your paper balls around through the air. Let's do it. Go right ahead. Nice. Okay, everybody pause for a second. Everybody who is sitting down, keep sitting, and everybody standing up. You can move to another person. So find a new sitting friend and then continue doing the same thing. Okay, good. Everybody pause again for a second. Now you can switch position. So other person is sitting and standing within your couple. Change places and then keep going. Whoop. Change places with your friend. And go right ahead, continue. All right, and then the next stage is to send your balls 4 times one way, and then you go 4 times the other way. And then you switch back. So we're going both ways. Okay, pause for a second. We've come to the final stage. Everybody is doing great. Different solutions to the task everywhere I look, and I love it. Now I would like you, with your friend, to find another couple so you can make a group of 4 and really lean into that creativity that has already started to emerge when you create your juggling show. So the 4 of you together with your balls, make a juggling show. Go right ahead. Okay, nice. I will pause you there. Everybody stop. I can't stop you now. Stop your juggling shows. Stop developing your I I love to see it. If you would pause your juggling shows, that was really great. In the corner, I can't make them stop. Stop. Good, thank you. Yeah. Very nice. Thank you for participating in that paperwork. If you would please come back now to take your seats, I will give you a moment to reflect. With your table neighbor, think together about what types of connections were created through this activity. Pretty open question, but think together with your seated neighbor about what types of connections were created throughout this activity. I'll give you 2 minutes. Let's do it. All right, that's 2 minutes there. I know there is lots to say, and there are many of you around each table, but I am a little bit rude and interrupting you now to move on. I hope that your discussions may be resolved around connections to others, I'm guessing, because it's very interactive. Moving together makes it enjoyable and valuable. Maybe you developed your relationship to yourself, thinking about, I saw a lot of failing happening, like balls hitting the floor. Doesn't matter, because when everybody's active at the same time, we're regulating the audience effect. You don't have to be afraid, more extra afraid of failing because somebody's watching you. So these are the quality aspects that we need to very intentionally think about when we're creating movement experiences. Your connection or relationship to objects, like you had your ball, squeeze it really tight to make it fly like you want to, and then you get your friend's ball and it's like all loose and like I can't throw this. So you're gonna like, so you think about that. That's your relationship to these objects. Can be other living things as well, not only persons. And the connection to this group. We're doing something together. It's looking beautiful looking out from the side at all these colorful balls flying through the air. So very big thank you for participating and doing that paperwork. And these connections are not going to be the same for all. It's a very unique and individual experience, meaningful and valuable to you for your own reasons. And when we did that Zoom and SAP thing in the large opening session the other day, I loved that. That was also really interactive. And the minister coming up after, he said jokingly, we should do this at every government meeting. And I really think they should. We are moving on now to not only listening to me, because this session is not about me. I'm only supposed to moderate it, so I'm going to try to not be myself, speak as little as possible, and invite up on stage some of the experts that you will be hearing from today, when we get samples from different ways of describing and operationalizing physical literacy and health literacy around the world. First up, no, not first up. Everybody will come at the same time, but first I say their names. We are going to hear from Amit Malik, who is the International Advisor and Trustee of the International Physical Literacy Association. Charlie Crane, who is the head of Children and Young People Policy at Sport England. And Kristine Sørensen, who is the founding director of the Global Health Literacy Academy. So let's welcome them up on stage with a big applause. Here you go, chairs for you. And I think that first off, we are going to hear from Amit. So microphone is on, and this is for you to change the slide and start your material.
So good morning, everyone, and I want to share our journey of physical literacy in India. And when we started, we had a Sports for Life team, IPLA team to support us. And in that initial part, we thought it's very complicated subject. There's so much of science into it. What age needs to be done? There has to be best world-class equipment. There has to be visualization that child should look doing some fundamental movement skill. There should be some sports skills. And we failed when we tried to emulate that in India. Because we never looked at what was inside us already for the physical literacy. Physical literacy, then we start looking at, has there been an attempt to look at in Indian context? We found the word physical culture was the word used in India. And being a land with a lot of wisdom around the life, around the spirituality, the word was used, physical culture is to bring consciousness and awareness to each cell in our body. That was the word used, physical culture in our context. And then we start looking at what is existing in our culture, starting connect that to the people's daily activity lives. And we looked at the concept which we should take to people at large should be relatable to everyone. 5-year-old, 95-year-old, person working in office, housekeeping guy. We looked at everyone's physical activities journey and start asking question, what makes you active? Why you're not active? And then we start finding answer that what is common is there is some social, there's some cognitive, there's physical, there's a emotional engagement in physical activities. And we try to then simplify it. So this is a video I want to show about how we connected with physical literacy. The gentleman who is speaking is our national badminton coach. He's a celebrity figure and maybe very well known in Denmark as well. He was all England champion and produced many Olympic medalists. And now he want to uh, have our government to pursue physical literacy rather than the medal-centric approach.
Our culture actually had physical activity as a key component, whether it's yoga, kalari, or our art forms of Bharatanatyam, Kuchipudi, Kathakali. All of these things were movement based. Are things like temples being on hilltops and yatras needing us to move a lot, or our culture of sitting down and eating or bending to elders, all of these things actually had physical movement incorporated into our lifestyles.
So in a way, we realize physical activity literacy is always already there with us, and we just try to connect to the culture context. And simplified way we looked at it has to be unique, non-judgmental, non-comparable, experiential, progressive journey. That's the way we define physical literacy in our context.
Thank you very much, Amit. I'm going to ask you guys some questions a little bit later, but first we hear from all of you expert speakers. So Charlie is up next.
Perfect. Thank you very much. So it's fantastic to be here with you all here today, and great to share the stage with some brilliant thought leaders in this space. I'm going to spend a couple of minutes talking through why physical literacy matters so much to us in England. So, for many years, we've had challenges around low levels of physical activity and widening inequalities. And despite significant investment from ourselves and many other partners, we cannot turn the dial on these two things. So for us, this is where physical literacy comes in. So back in 2023, we were really excited to launch our physical literacy consensus statement that was put together by 60 stakeholders from a range of sectors. And really, this has given us a shared narrative around why movement matters. And it's been really popular amongst many of our partners in a lot of different sectors. We now define physical literacy as our relationship with movement and physical activity throughout our lives. And like any relationship, our relationship with movement is deeply personal, unique, and ever changing. And it's easiest to summarize our consensus statement in three ways. Firstly, the blue triangle, that we need to create movement opportunities that give individuals and communities enjoyment, meaning, and value. And this is especially important with my children and young people hat on, because enjoyment is the single biggest driver of activity levels for children in England. Moving then onto the orange box, and this really helps us to articulate and demonstrate if we get our nation moving more. Yes, it builds their physical competence, but it helps them to contribute and develop skills that they need in all aspects of their life that contributes to a healthy, happy society. So actually, if we get our nation moving, we're going to help them to move, but we're also going to help them to connect, think, and feel as well. And the red circle leans into our inequalities focus in England. And it recognises that access and opportunity to be active is simply not an equal playing field. So for us, our consensus statement helps partners, policymakers, to take a step back and look at all of the different factors, often beyond an individual's control, that influence their relationship with movement in both positive and negative ways. So for us, the consensus statement is really starting to change how we're designing policy, how we're designing programs, and how we're designing movement experiences for individuals and communities. We have now, over the last, we only published it in 2023, we found that partners talk about physical literacy in two ways. Firstly, as an outcome, we've created a shared narrative around why movement matters. Whether I'm speaking to health, education, planning, we all share a belief that we want our nation to be happier and healthier. A movement can be part of that solution. And then as a framework, our consensus statement is really helping policymakers through to practitioners think of all the important things that we need to take into consideration when we're designing our movement experiences, and each and every one of those experiences help those individuals and communities build a lifelong love of movement. So I've only had a couple of minutes. I am around all day if you're interested in finding out more about our consensus statement. And in the next session, I'll be diving a bit deeper into our implementation approach. So thank you, Grim.
Perfect. Thank you very much, Charlie. And last but not least, Kristine, if you move that slide forward, we are happy to hear from you about your view and work around health literacy and why that is needed.
Yeah. Thank you so much. I have a background in public health science. So for me, I'm focusing mostly on the health perspective, but as you know, the World Health Organization defines health as the physical, mental, and social well-being of people, not only just the absence of disease. So this is my take on being here today with health literacy and physical literacy. So I can tell you, I have a public health background. Before that, I studied medicine, but I was much more interested in health promotion. And health promotion was not really taught in medical school. It was all about fixing and repairing and doing treatments and so forth. So I moved into the public health space. Then I started working in Netherlands at Maastricht University and got the task to coordinate a European project on health literacy. There was just one challenge. I didn't know what health literacy was. Despite having a medical studies, I didn't qualify as a medical doctor eventually. My public health studies, I've been teaching for several years at the European Public Health Program. I never ever heard that term, health literacy. So what do you do as a good researcher? You start doing a literature review. So that has kind of formed my view on health literacy. And one of my favorite definitions is this one by Ilona Kickbush. Health literacy has been defined as the ability to make sound health decisions in the context of everyday life, at home, the community, at the workplace, the healthcare system, the marketplace, and the political arena. Because she nicely takes health out of the clinical settings into our everyday life. But then we also, dived as a good researcher to dive into all the different definitions, and they were all kind of overlapping. And we made this very comprehensive definition saying health literacy is linked to literacy, not necessarily the same, enabling people's knowledge, motivation, and competencies to access, understand, appraise, and apply information to take decisions in everyday life concerning healthcare, prevention, and health promotion to maintain and improve quality of life during the life course. It's a long one, but it makes a lot of sense. Literacy and health literacy and physical literacy is not the same. And literacy is not about reading and writing only. It's more than knowledge. It's the ability to act. So it has this component of action to it. Then being able to access information, understanding it, getting it in a language or in a way that you can understand, take decisions on your own behalf, and form this judgment and actually be able to act. And then we take it outside the healthcare setting into prevention, but also much more importantly, to the health promotion setting. I also add here in this definition that health is not an end goal, it's the quality of life, which is where also lifestyle, healthy living plays a big role. So after that, we thought we were good, but then we started looking into the data and we realized that more than half of people are finding difficulty to manage their own health. And this came as a shock to the European decision makers at the time. They thought we had good welfare systems, good educational system, good healthcare systems, and then, well, something is off, wanting to find it difficult to actually access, understand, judge, and use information to take care of their health. So we started to challenging our systems. We can't just blame people for not knowing. We can't blame kids for not knowing. We can't blame the elderly for not knowing. What we can do is to look at what forms health and well-being, what forms physical well-being, mental well-being, social well-being. And this is where our model came out here. Many of you may already know it. You see the center is about the competencies in the different domains. It changes over the lifetime. We can look at it from an individual perspective, but also a system perspective. And to the left, you see some of the influential factors, of course, personal factors, age, education, ethnicity, religion, whatever, and also the situational perspectives where you live, love, work, play, so forth, shapes our mindsets and our opportunities, not least, and the same for the wider social and cultural aspects that you were mentioning. And then we know from research that this has a high impact on how we use healthcare services and social services, and therefore also the cost. It has a high impact on our health and well-being and the behavior. It has a high impact on how we engage with each other, the connections, the relations, and how we are being empowered to take care of our own health. And not least, it has an equitable dimension to it. So those, unfortunately, who are poor, who have poor health and poor education, or very often also have poor health literacy. And that's where you come into the picture. Because for me, health literacy is not an individual trait or status or condition. Health literacy is something we shape together. So we are the champions, you are the champions in whatever function you are, whether you help the individuals, whether you help school settings or communities or work in sport clubs, or whether you are in some kind of larger position and larger strategic position in leadership or in government, we all have a role to play. And this is my main message, is that, you know, health and well-being, quality of life is really the bigger picture. And we all try to give our little sense to make it happen.
Yeah.
Thank you.
Yeah, thank you very much. I think that wide understanding of who a health literacy provider or supporting person can be, like it's all of us, and it's not limited to only one profession or function. That's really insightful. Thank you. I would like to ask you guys a question. I don't know who would like to answer it first, but it is about literacy and about physical literacy and health literacy, and what is it really that word adds? Like, how does physical literacy relate to physical activity? How does health literacy relate to health? Like, what is the difference there, or what does the word literacy add that was not there before?
So just reflecting upon that, we are part of this MOOC Congress. We can consume this just cognitively. What is the position of the room? But we also moved around to be part of the environment. So when cognitive is also added with the physical, then you had experience in every part of the same Congress, having the break or in room has memories, experience, whom you met, what you experience you had. So in a way, when we look at physical activity, initially was very number specific, how much time, this activity, this skill. But when you look at physical, it is about looking at our existence as a whole. And that philosophy of Margaret was very relatable to Indian context, because our yoga, our culture always look at we as one. How can education have academic and peace separate? We are one. So that was easy for us to connect that the experience are together. And as you said, that we look at then physical literacy as helping each individual to reach their best potential of existence, to flourish in their life, to have a best quality of life. And then physical activity, we kind of number part we remove, that we are looking at experience. And that message we have taken in all our assessment. We have not done a single quantitative assessment. All is experiential. It's a self-reported journey of the children. Am I motivated to play every day? Do I feel confident, and when I go to new environment and new opportunities come to me, am I competent at different physical activities? So that narrow looking at just activity number, we just changed to the individual as a focus, human flourishing as the focus. And we feel that a lot of stories come through that. Just to go to a simple story, that there was this workshop of parents, grandparents, and children together. And after 5 minutes, one children stood up, can I explain physical literacy to my parents and grandparents? And he said that, Mama, you told me I used to kick in your womb. Then when I was born, you gave me some bottle which I need to use, how to hold the bottle. Then I start walking, jumping. You celebrate all my physical milestone. Everything is video recorded. And then all of a sudden change, school comes in my life, and you ask me to sit. Now I'm a good boy only if I sit for 5 hours. Why this changed? Just because we allowed such lot of experience to come. So this is why I will conclude looking from the lens of the activity number to journey,
Right.
non-judgmental journey of
Nice.
each individual.
Yeah, thank you, Amit.
Can I just add to that?
course.
Thank you, Amit. I think from our perspective, we see physical literacy as being the North Star. I think previously as a sector, we've talked about physical activity, like Amit was saying, guidelines, get the nation moving. But actually, physical literacy, that we want children, we want adults, we want communities to have a lifelong love of movement, a lifelong relationship with movement. So I think for us at a policy level, it's kind of elevated the importance of making physical activity a great experience in the line of sight that hopefully they will then have the skills, the capabilities. It's a learning concept, that anyone will have the agency to then engage in physical activity throughout their lives, and most importantly, to enjoy it. So thank you.
Thank you. So for me, the linkages is looking at literacy. In many languages, it's very difficult to translate the term literacy. I used to live in Netherlands, as I said, and there it's called gezondheidsvaardigheden, so vaardigheden in Danish, which makes sense also. You can translate it as health skills. In German, it's called Gezondheidskompetenz, and in Denmark, we kind of leaned on that and call it Sundhedskompetenze. So, and then I talked to a native speaker saying competency is about ability to act, which is what I lean on. It makes a lot of sense. It's much more than knowledge. It's this empowerment of being able to take part in your life and in your community. And let me just bring in a very personal note.
Sure.
I'm a proud mom of 2 sons. One of them, he had some difficulties for some years. He gained a lot of weight due to mental distress. Last year, in September, he was challenged to run 5K for the big event that every Dane would know, the Stafette, and at his workplace. And he couldn't really run, but he practiced for 6 weeks. He finalized the 5 kilometers in Aarhus, where we live, and we were cheering him all the way through, and he was really proud, but also very, very tired. But that triggered something. So in the past year, he lost 40 kilos, and last weekend he was running for Connect Cancer, a cancer charity, 7K, with a smile on his face, and just, he could have been running onwards for so long. And for me, that, standing watching him, not only being the mom, but also with my health literacy hat on, that was definitely also the living proof of physical literacy. And if we can trigger this kind of change with more people, I think we have a much more healthy society.
Yeah.
And mind you, this was not me telling him to do it. It came from his environment where he was working, the friends he was with. He actually brought 6 other classmates with him last Saturday to run, who also didn't run before. So it's spreading, it's contagious.
Yeah.
So let's spread the good things.
Nice. Yeah. Thank you for sharing that, Kristine. I think that, yeah, not a lot of people like to be told what to do. That's called micromanaging. And if we can find those intrinsic reasons to move and to want to live a healthy life, that's, yeah, of course, advantages. I will turn it back to you, Charlie, because in your slides, you really highlighted that physical literacy for you can be considered both as an outcome and a framework. Why was that important, and what does that mean, really?
Really good question. I think from us over the last year, since we've tried to implement the consensus statement into policy and practice, we found partners getting quite stuck up. Sometimes they were talking about it as an outcome, and it depended what audience they were talking in terms of that lifelong relationship with movement. And then others were using it as like the blue triangle, the orange box, and the red circle, and thinking, well, I'm using it more as a framework. So actually, we decided to just call it out and say, actually, depending on the type of work you're doing, the audiences you're speaking with and connecting with, you may refer to it as an outcome or a framework or both. And it just helped sort of, the light bulb moment went off for so many partners who I think were overcomplicating physical literacy, because I think it can be quite easy to overcomplicate and you can kind of get yourself a bit lost in it all. But kind of bringing yourself back and thinking, okay, within my day-to-day work, is physical literacy going to be the narrative, that shared outcome that I want to go into different sectors to talk about the value of movement? Or do I want to use it as a bit of a framework if I'm a coach or a teacher, to think about all the things that are important in creating brilliant experiences? Because we believe that every positive experience, especially a child has, is more likely to give them that love and relationship with movement that will last a lifetime. And I'm sure we all know people who have had just one really bad experience in PE. Like I can remember lots, but actually I withstood it, and that's kind of the physical literacy side of things. So yeah, I think it very much depends on your audience and how you're trying to sell physical literacy as sort of an agent for change.
Right, yeah, thanks. I think that the word that you're using, also experience, it's something different than an activity. For me, I associate an experience more with the whole me coming to do it. I'm thinking and I'm feeling and I'm moving and I'm connecting constantly and ever changing. But Kristine, if I could turn that same question over to you, does that apply also to health literacy? Is that an outcome or a method, or how are you thinking about it?
Yeah, definitely the same line that you're talking about. And if you look carefully on the model I just showed, the arrow goes both ways. I tend to explain it as from left to right, but it actually goes the other way around. The way we shape our environments, the opportunities we give to empower the people we work with, the way we support their health status will also influence their health literacy.
Right.
We do see that those who have challenges, they very often also don't have the trust in healthcare systems or school systems or social systems. And sometimes those with high health literacy also don't have the trust, but for different reasons. Those with low health literacy or limited health literacy, they might not trust our societies because of dis and misinformation, myths. They don't know really what is right and wrong, true and false. But those who have high health literacy, they more about knowing that the opportunities are not there. And that's where health promotion is also in the play, that you can actually shape our system. So you would have now, it's election time in Denmark, and you have a lot of discussions. Should we have a new, pool in our city? Should we have a new stadium? Should we have a new sport place? Should we give more resources to the schools to have physical activity? That's where the highly health literate people can support physical literacy.
Oh, thank you. Yeah, that's really insightful, that we don't only blame the individual. We need to provide the systems to support them in society as well. Okay, well, that was the final question. We don't have time for any more for now. Thank you very much for joining us. Let's give a warm applause for the expert speakers. Yes, you're free to go. Yeah, thank you very much. And yeah, moving on now to the next segment that is more interactive, and the idea is to do some co-creation work around every table when we move on from introduction of what these concepts are and why we need them to thinking about their complementary nature and how we can merge these concepts, put them together in a shared model. And to guide us, we have with us Dean Krillars, who is a neuroscientist at the Research Center for Human Potential in Montreal. So let's welcome him as well with a big applause.
Hi. Hi. What a great Congress. Yeah? 800 people. And I don't know where ISCA was before it, 300 maybe? I don't know what numbers. But it's amazing to see all the sectors here today. So many different sectors. And yesterday we had a physical literacy expert group meeting. And we said, who's here? And we celebrated who was in the room. But then we said, who's not here? And I want you to think about that. Who's not in this room who needs to be here? And that's really critical for all of us, whether it's health literacy or physical literacy. And I think it's exciting to think that you're all here from different sectors coming together because we want society to move more. It's a very simple thing, right? In 50 years of pushing this idea from every different sector in the world, not a single place has succeeded. And that's where health literacy and physical literacy maybe create a different way of thinking about helping societies restore movement. And I'm going to walk you through the complex concepts that we just talked about that can be overly complicated, but I want you to talk at your table. You move together. Grim did a great job in making you connect to each other through juggling. You'll notice that he didn't say juggling because that would have scared a bunch of people. Because you would have said, oh, I'm not a performer. I'm a person, I'll move, but he called it paperwork. Interesting, right? So almost nobody I watched, nobody got scared about moving in front of other people, and that's important. Scaring people, making people feel uncomfortable moving is a very bad thing. And yet we do it often, and we don't realize it. So I'm going to make, at each table, you'll notice that you've got some paper. Yeah, you see it? And you've got some beautiful pens inside of this here. It's a beautiful pens. And what I want everybody to do right now is hold up your finger at your table. Just go like this. Yeah, good. And when I say 3, you're going to point to the person who's going to get a pen and write down information. Okay, you ready? Ready? Yeah. And actually, you don't, if everybody points to you, you don't have to do it. But I do need somebody to write, okay? But it'll be fun. Ready? Finger up. 1, and you point to the person who thinks can write good, okay? 1, 2, 3, point. And you know what's really interesting, what just happened there? I want to point out 2 things. It becomes very difficult to stop you now, and that's good. Just like when Grim had you create a juggling show, you didn't want to stop, and you almost got angry at Grim for saying, oh, but we want to make our show. It's important to let that moment of connection between people with the point materialize. If I cut you off too soon, that connection is not good to break. So that's important. That little exercise I did of pointing at each other, it's not rude, it's fun. You all put smiles on your face. Remember when you're throwing the balls and they're hitting the ground? You were laughing. I could hear. You were laughing hysterically, failing miserably. Isn't that wonderful? Isn't that wonderful? Fear of failure. No, failure is part of success, not dejection. Failure is a really important thing to embrace. Anyway, so we got the person, somebody's going to take the pencil, and you're going to have a piece of paper, there's 3, and you're going to write things down in one column, middle, and on the other side. You'll get it. Everybody good? So I'm going to show you, Grim, if you can advance the slide
course.
to the next one.
Yeah.
I only have one lecture slide. This is it. And I know that Kristen, Sarah, and others, people in this room, this is a really important slide because I want you to feel where we are in the world. On the top slide is the word literacy in English and how often it appears not in research, but in public documents. If you value something, you write about it. So this is a valuation indicator. And you'll notice from 1900 to now, literacy has increased almost linearly for 125 years, going from 21% of people in the world who could read and write now to 87% of the population of the world can read and write. It only took 125 years. I make fun of that, but not really. It was 125 years of literacy discussions. And that's important. And the amount of the word use of literacy worldwide is massive. On the bottom, I've shown you numeracy, mathematical literacy. And very interestingly, they only started measuring mathematical literacy in the year 2000. After 60 years, they only decided, how do you measure mathematical literacy? It took only 60 years to figure out how to measure it. But you'll see right here where I have the arrow, John F. Kennedy, a good US president. I'm a Canadian. Now, it's interesting because in 1962, John F. Kennedy stood in front of the world and said, we need to go to the moon. And it's not enough just to read and write. We have to do math. And he used the word numeracy. And as a result of that, science, technology, engineering, and math around the world grew from one person's speech, literally. But we're 70 years into numeracy development around the globe. Not every country has good numeracy, and I'm going to tell you a scary story. In the last decade, almost all countries in the world are going backwards in numeracy. This is a really bad thing. So we're going to be on guard in the physical and health literacy world. If you look here, the scales are not the same, by the way. If I put health literacy and physical literacy on the scale of literacy, it's this big. But I zoomed in because both physical literacy and health literacy have really grown in the last 20 years. And that's in public documents, not just research, exponentially. So I want you to feel we're only 20 years in. We've got a 100-year journey. But maybe we can learn from the other literacies and maybe accelerate. And you'll notice that, see, the curves are actually pretty steep, aren't they? This is exciting news. They're becoming part of our vocabulary, even though there's difficulty in different countries to find the word for literacy. So I work in Canada where we speak French and English. And originally, for my friends from France here, we used to say physical literacy, and we took 6 months to convert the word physical literacy into French. And for my French friends here, originally we used to say savoir-faire physique, which means I move well. But actually the word littératie physique is a word in French, which is the better word. It's still savoir-faire physique. That's good. I like that. It's très sexy. But I wanted you to see this because in each one of these literacies, there was definition discussions. They had definition discussions through the roof. There's over 20 different health literacy definitions, over 20 different physical literacy definitions. It doesn't matter. The principles are the same. And that's really important. Don't get caught up in the definition. They always evolved. And almost every time they succeeded, which we just heard beautifully, they figured out a process by which to implement. And I want you to see that slide as you go into this discussion at the table. Next slide, please. Thank you. So the very first question is this, and you're going to talk amongst each other. And Kristen and Charlie and Amit set us up good for this. So somebody's going to grab your paper, and you're going to lay it down. You're going to get your pen, and everybody in the room is going to go, what are the daily routine decisions you make about health? And for about 30 seconds, you're going to go like, Blah. And then you're going to start, each one of you is going to go blah, 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 blah. Like last night, I had to decide, am I going to have 7 beers or 2? Ah, 7. 7, of course. But, however, because it was Danish beer, I mean, well, I'm a Canadian, what's Danish beer? It can't be a problem. Anyway, but I want you in a group, and one person's going to write down on one side of the paper all the decisions you make related to health every day. And this is going to really link to Kristine's slides in a big way. So start talking. What are all the decisions you make daily or routinely about health? Write them down. Go, go. Yeah. Somebody write down. Yeah. And just a quick break for a second. So you're already, and this is important. I don't want people to feel this. You're all leaning in. You're leaning in, right, into the conversation and realizing there's a lot of decisions you make in a day, right? Like, what type of food do I buy? My kid's got a fever. What's the numbers at 41 or 42 when I take them into emergency? I want you to think about lots of decisions you make every day and keep writing all the decisions. And then I want you to start thinking about, and this is important to keep going, I want you to think about the topics, because it could be sleep, it could be food. So just also write down the topics. Keep going. Go, go, go. And pause just for a second. In Canada, my friends came up to me and they said, Dean, I want you to join yoga. And I have a bunch of kids who play hockey. And in Canada, if you have kids that play hockey, it's $20,000 a year per kid. How much you pay? I'm not joking, $20,000 a year per kid. So that's $40,000 a year I'm paying for my kids to play hockey. Somebody asked me, my friend says, Dean, want to do yoga? And I go, oh, I'm broke already. But I don't want to tell you that because yoga's cool. But I don't have any Lululemon. I don't have a nice water bottle that's that big for my hot yoga. And it costs $140 a month to go to yoga. So that's $2,000 more I need to go to yoga. How do I say no to my friends who've got the money, but I don't? I'm trying to put something into your mind that each one of these beautiful decisions that you're talking about here is actually interacting with many topics, financial topics, sleep, nutrition. You're talking about that, I'm sure. But I wanted to give you an example, a movement-related example. That's a decision. Do I do yoga? Do I walk up and down the stairs or take the lift? I saw it on your list. There's hundreds of these, is there not? So I'm going to show you the next slide because you're getting there. Because I kind of know if you look at your list of questions, and in the middle you can write down all the topics, but I'm going quickly. See each one of these? Did anybody talk about death and dying? I doubt it, because that's not a daily routine question, is it? But interesting enough, today and tomorrow in Mexico is the Day of the Dead, where they celebrate death and dying. Most cultures don't do that, and death and dying becomes daddy went to sleep. But I already own, and I'm not joking, my urn. I'm going to be burnt up and put into a thing, and I own it right now because I bring it to people. I don't show the inside because I'm not dead yet, but I have them sign the urn saying, say something nice to me now while I'm alive. But death and dying has skills. Death and dying has knowledge. Death and dying has motivations, not to die typically, but sometimes to die. But it's really interesting that if you look at all of these on this slide, I guarantee that on the table, you've already covered these topics. Would you agree? Some people are talking about bullying and social emotional learning. It's there. Spiritual things, cultural, linguistic, physical, sexual, reproductive, and gender, climate. We've got a great group here called Protect Our Winters, which uses this approach, actually, interestingly enough. Why do we protect our winters? all of these reasons, there's good reasons. So you came up with a list of decisions, lots. But you're seeing all the topics that you're covering. Should you use ChatGPT or should you not? Is that a good thing or a bad thing? Good question. What's the right answer? I don't know. But do you see the list? I didn't show you that list. You created it. Do you accept that? You already had this knowledge. So, and you maybe even had some more that I didn't think about on your list. When we finish today, we're going to take these and put them on the wall, take pictures of them, and give them back to you. So everybody's list is going to be seen by everybody else. Make sense? So we're going to move on to the next slide. And this is a big one. So in the middle column or the last column right now, I want you to tell me who would have, past tense, influenced these decisions. Who? I'll give you a little hint. It could be grandma. It could be God. It could be whomever. And I don't want you to think about sectors like the sports sector or a medical doctor. I want you to think about all the different people in your life that prepared you to make those decisions and make the list. Ready, go. Who prepared you to make decisions? Go. And one quick pause, sorry to interrupt again. We have some people here who come from a country where Dracula comes from, right? It's Halloween. It's Halloween. Did you bring Dracula with you? No, you didn't. Dracula stayed at, I just want to tell you, they did not bring Dracula here today. So nobody's going to be sucking your blood. So I just wanted to share that. Thank you for confirming that Dracula didn't come. But I'm going to quickly do this. I'm pretty sure you got a pretty good list already. Yeah, of people. Can you just flick the next slide? There's the list I made. Family, friends, teachers, instructors, coaches, employers, designers like architects, healthcare providers, agency representatives like the WHO, digital media, the internet as a creature, and then institutions like church, governments, and maybe some others. Maybe your pet talks to you. Maybe your dog tells you what to do. I don't know, maybe, often. So in my house, the sign says, pets welcome, people tolerated. I love pets. I connect to animals a lot. But that's the list. I'm pretty sure you had similar lists, yes? Yeah. Now, the next activity is going to be a really fun one. Next slide. I'm pretty sure you can draw a target on your sheet of paper, maybe a new sheet of paper, new one. And you draw a target with the center, and then you make a ring on the outside and a ring in the middle, maybe not that many rings. And what I want you to do is pick one decision. It could be about drinking, it could be about sleeping, I don't care. Pick one decision, and at the table, see the list that you made? Family, friends. I want you to say, if those people influence your decision massively, they're at the center of the target. If you say family and friends are the most important, you put them in the center. Beautiful drawing, by the way. Better than a 3-year-old. Excellent. Did you do that? Beautiful. Hang on. If the people do not have influence, you put them at the edges, okay? So you use these names and you put at the center the most important people for your decision. Okay, ready? So pick one decision and then draw it. Go for it. Have a chat. Folks, 1 second. Quick pause. This is really good because you'll notice, and this is important, everybody's leaning in heavily now, okay? And you're having some tension because of this. And this is the point of the discussion, to feel this tension. Watch. When you draw that target, barely anybody has actually put any answers on the target yet, because you're negotiating between each other about this. I've done this once before. You're saying, well, if you are making the decision about you, I'd put friends and family in the center, and I'd put these people at the edges. But if it was you, I'd change them entirely. That's the point of this. And then if I change the decision to one on sleep from food, it changes again. This is a very important thing for this group to feel right now, because every individual in society is faced with all of these people telling them different things and having different influences on them. And therefore, if you are trying to take your own perspective about decision making and apply it to them, it does not work. Health-related decisions are individualistic, culturally specific, context dependent. That's very academic, but they are. But I do want you to take, even if it's one person of your table, and put the target and say, for me, we'll make it easy now. For me, this is how I put these people in the center and the edge. And then you can go, Tom from Umio can say, well, no, not for me. I never listen to my grandma. But grandma is really important to Lau because his grandma he still lives with his grandma, right? I know. Yeah, she's really nice. I like her. Everybody good? So do try to make, and you've already made one, which is excellent, but do now maybe shift the decision or shift the person and say, how does this structure change again? And we'll just spend a couple minutes on how does this structure change based on decision and how does it change for different people? Go for it. And pause. So I'm sorry I'm cutting you off. This is a process. And we could spend an entire day doing this and having these discussions, but I want you to see that we're talking about a very complex system, but we're untangling it and realizing how individualistic this is. So in the first half of this, if we go to the next slide, all we did was we talked about the topics that are relevant for health. And I've put my list, that's my list of topics. And I'm very happy today to say, this is Sarah Bennis right here. And she's from the, have you heard of the United States of America? I've heard about it. I don't know. Canada is buying the United States next week. $2. It's a sweet deal. I joke, but Sarah come to us. So Sarah and I work a lot in health and physical literacy because Sarah is the past president of the Society for Health and Physical Education in the United States. Over 250,000 phys ed teachers and health ed teachers in the United States. We work on this together and it was really important because Kristine and Sarah hadn't really talked before. And so that discussion between them was really critical, and it will be with you as well and others. So I strongly encourage you to talk amongst your sectors later on using this framework. But all we did so far is this. We said in the first half, we said, here are all the topics that we can talk about related to health. And I'm going to tell you something right now because we are set up for it, is that each one of these is a literacy. Every single one of them has an entire literacy. There's an entire organization called sleep literacy. There's an entire organization, you can Google it, death and dying literacy, nothing to do with the healthcare system. There's an entire literacy on healthcare literacy. There's an entire literacy on physical literacy. There's an entire literacy on sleep and food. But all of those are health related, are they not? Every single one of the definitions of each one of those topics has a literacy. But all of them have a well-being outcome. Every single one of those has a well-being outcome in its definition. Therefore, it's not a discussion of where does physical literacy and health literacy exist. Those are all the literacies that are part of being healthy. And you've just convinced yourself of that because of the decisions you have to make are related to all of those. I work in the circus industry. My primary job, I retired, but now I work in circus. And interesting enough, in my world of circus, we have so many different, every single gender is represented in circus very prominently. So we have a lot of gender equity discussions, and we're pretty good at it in circus. So for us, it's not just about, if you look on that slide, it's not just about sexual literacy, which is one thing, and reproductive literacy, which is another. It's also about gender literacy, which is an entire field in itself, which is, all three of those are very different. But I put them together because they're related. But I want you to see that. The other thing you did is you told me there's a bunch of people, which we call agents. There's a bunch of people that influence your decisions. And that's the list. There's more. It's not a perfect list. But you now realize that there's an interaction between the people on the right side and the topics on the left. And you now realize that they all have different weighting in terms of how you make your decisions. If I go, anybody here from Italy? Italians? Yeah, ma che fai? Yeah. So later. So I just asked her through physical literacy, do you like spaghetti? Do you want to have some spaghetti? Yeah, later on. Yeah. Huh? Yeah. So what's important here is that in Italy, there is a tradition related to who cooks. There's a tradition, a cultural tradition, which in Canada, Italians who live together, typically the female cooks for the male. Is that right or wrong? Not a discussion. It's if that's true. So if you have a decision related to food for a male, but the male doesn't cook for themselves, how do you intervene? Interesting, right? See the complexity of the question? And this becomes interesting because I needed you to see that there are a lot of topics, and physical literacy is just one part of health literacy. Really importantly, there's interactions between each one, isn't there? Financial relates to physical, right? Sleep relates to nutrition. Nutrition relates to sleep. Everybody get this? It's important. So there's no most important literacy there, is there? You're like, let's not play the game of my literacy is more important than yours. It's to be healthy, everybody in the world needs to make these decisions every day. But we, as a group, from every sector, is not doing a great job. But we've got another 100 years to make it great, okay? How close am I to finishing?
2 minutes past.
Oh,
Yeah.
I am done then.
Yes. Let's give
Okay, hang on. Next half.
Right.
Yeah, go.
You can push for that.
Oh, I can?
Yeah.
So next half, we take this slide in 45 minutes or so,
Yes.
and we're going to take the slide and move deep. We're going to go deep into how do we then change the world with this knowledge. That's what we're going to do next. So when you come back from your break, you come back and sit at the same table, or maybe change tables. It doesn't matter. So thank you very much.
Thank you. We can even. Nice. Yes. And Dean will, together with other speakers, be back in the next session as well to share with us more and guide us through the second part of that workshop. We wanted to give you, in the closing minutes of this first session, a moment to reflect, because I could tell that everybody was really focused on working on these questions now in the time that you had. So with your table neighbors, think about one insight that struck you extra deep, like one aha moment for yourself, and share that with your neighbor. Or if you got a question that you're taking with you to the next session, that could also be something to express. So think together with your table partner about an insight or a question from this session that you're taking with you. Let's do that now. Go right ahead. Okay, good. I will cut you off now on your discussions. I feel a little bit rude and like you don't want me to, but you can continue in a couple minutes outside when you're grabbing a cup of fika, coffee or something. I don't hear all the discussions, but some of my aha moments or insights that I'm taking with me from this is that with this list of health and movement related topics, as well as all the agents, movement and health providers that influence our daily decisions for ourselves and for others around us, it's really complex and multifaceted. They are all interconnected and deeply codependent. And I think that when we think about how to solve or go about solving a large and complex problem like health and movement of individuals in our societies, how do we solve a big problem like that? We need to make it even bigger, because that's what we're doing. We're thinking about not only our primary ball that we have, that is our task and our responsibility through our profession and through our relationships, and we're thinking about how it relates to a lot of other balls. And I think that that helps us position our question and better collaborate with others who are also health providers, but from other sectors and contexts. And it might feel like going the opposite way, like what we're used to, when we want to reduce and control everything and know all the measures on beforehand when we apply for funding or whatever it might be. So this is really challenging to me to wrap my mind around, but I think it's really needed and helpful, so that we can have a shared model that everybody owns equally and that feels useful to each and every one of us. The next part here is a reminder for you to take a couple of minutes now before you leave, before I tell you you can leave, to do the survey, the session evaluation survey. It should be in the schedule if you find this session, and you can start a survey there to give a quick feedback. So I will leave a couple of minutes for that before saying my final words, and then I will say goodbye. Hope to see you again on the second session. But first, survey. Go right ahead, take out your phones and find it in the Cvent app. Okay, hopefully most of you finished the survey already. Maybe you found your way into other parts of your phone. I don't know. But we're happy to receive it. Like, if it takes time to put the feedback, that means you're writing something, and we really appreciate that. Helps us make these sessions better in the future. Here is a show of the partners who have been contributing very valuable insights into the Moving for Health project. That was the starting platform for these sessions. That was co-funded by the European Union. And yeah, it's 10:30, so I will say thank you for now, and hope to see you again at 11:15 in the same room, continuing to develop our ideas that we've drafted together on the large paper sheets. So big thank you for now, and hopefully see you soon.